Good afternoon and welcome back. I'm Parmeshwar Bava. You're watching Beat Diabetes Myths and Facts. Now, diabetes in India is a growing health problem with more than half of the population at risk of developing the condition at any given time in their lives. Diabetes mellitus is a widely diffused chronic condition that impacts several aspects of patients' lives. If you do not manage this condition, you may develop more severe complications. Now, people believe that losing weight is one of the more effective ways to manage diabetes. Hence, they try fasting, intermittent fasting, or new age keto diets. Well, these may help in losing weight in the short term, but they may have adverse effects in the long term. Many religions practice fasting for spiritual reasons, but it can cause serious health problems for people with diabetes. The changes that occur in the body during fasting depend on the length of the continuous fast. It can affect your body badly if you do not take proper care while doing this. Now, to discuss these and other issues regarding diabetes, we have with us today an esteemed panel of experts. We have Dr. Bharat Sabu, the task force member of the Research Society for the Study of Diabetes in India, also known as RSSDI. Dr. Sabu is a diabetologist and the director of Prayas Diabetes Center in Indore. We're also joined by Dr. Sanjay Agarwal, the National Secretary, RSSDI, Head of the Department of Medicine and Diabetes, Ruby Hall Clinic in Pune. And we also have Dr. Brij Makkar joining us on this broadcast. He's the President-elect of RSSDI and a diabetologist and bariatric physician, also the Director of Dr. Makkar's Diabetes and Obesity Center in the National Capital. I'd like to take the first query to you, Dr. Sabu. Now, many people with diabetes experience fluctuations in their blood sugar levels throughout the day. What type of diet should such people follow? What do you suggest?
A very relevant question you have asked. Actually, the diet should be balanced as the calorie intake should be calculated by your diabetes care team. And you should divide that calorie intake according to the fasting regimen practice or the fasting practice you are following. Then you should have a balance of carbohydrate, protein and fat, because you should not avoid the balanced diet formula. Then there should be fruits also. You should go to the food which are low in glycemic index so that they can keep you full, because your purpose of fasting is supposed to weight lose. Then it will help you in sustaining the weight loss, and if it is for religious purposes, keeping you full will take your fasting for the duration you desire. And lastly, you should avoid spicy food. You should avoid food which is oily in nature, and above all, keep yourself hydrated. So you need to take whole wheat, you should take barley, you should take oats, nuts, more of I would say fruits which are low in glycemic index, and that will help you to remain full. For the non-vegetarian patients, they can take lean meat and chicken, they can include fish servings, and that will help them in achieving a sustained blood glucose level.
Right, Dr. Sabu, a balanced diet being the key, but obviously avoiding spicy food will be a bit of a task because the Indian palate, as you know, is used to spices, but a red flag right there. I'd like to take the next one to Dr. Agarwal. Now, Dr. Agarwal, the keto diet is a low-carb, high-fat diet. How does the ketogenic diet work for type 1 and type 2 diabetes?
Excellent question. I think there are a number of diets that are available in the market, and it's always a very big confusion as to which one should somebody follow. And one of them is, of course, the keto diets that we have got. As you asked that, can we do it in type 1, type 2 diabetes? Generally, these diets are more for type 2 diabetes. We don't advise them for type 1 or pregnancy-related diabetes. Remember, in this diet, we have almost about fats which contribute 80%, proteins about 15 to 20%, and carbohydrates about 5% of the total calorie content. Now, the body utilizes fat as a metabolic source for fuel and energy, and which otherwise is used by glucose. Now, what it really achieves is a significant weight loss, and through weight loss, an improvement in the blood glucose values. But there are certain red flags to these kinds of diets. One is it causes a lot of elevation of the blood lipids. In layperson's terms, we talk about cholesterol and triglycerides and all these things, which can increase the risk for a cardiovascular disease. It also increases the risk for stones in the gallbladder. It can cause a condition what we call as ketoacidosis, where there is more ketone generation and acidosis of the blood, and it can predispose people for lowering the blood sugars, what we call as hypoglycemia. This is very true because as weight comes down, the requirement for medications come down, and if you're not keeping that in parallel, then patients experience low sugars. At the initiation of the diet, some people do experience flu-like symptoms, what we term as keto flu, and this diet doesn't factor in any vegetables or fruits, so you're not giving adequate fibers and vitamins. More important is this diet is not sustainable in the long run, and we have data only up to approximately 1 year around as to what this diet can do in short terms. But we don't have any long-term benefit data.
Right, that it makes it clear that the food choices you make will definitely affect your energy and blood sugar levels throughout the day, as you've just mentioned, Doctor. I'd like to take the next question to Dr. Makkar. Doc, what dietary alterations should a person make during fasting?
So again, very important question. There are two things that one have to keep in mind when you are making dietary changes, and it will depend on, number one, what is the duration of fast during that day, and second is what is the type of medications person is already on for treatment of diabetes. So there are now currently medications, if they are being used, they do not cause low sugar levels. That Dr. Sanjay just mentioned, the risk of hypoglycemia with the keto diets or fasting also. So if they are on those medications, actually they can continue to take those medications, and they do not need to make much changes in the diet or the food intake during fast also. But there are other medications which can push the sugar levels very low, or especially the people who are on insulin. Then fasting is usually not advised for these patients. If they still want to fast for religious reasons or whatever reason, then they should consult their physician and make the dietary changes according to the advice of the treating physician or the dietitian who are they consulting. Generally, the food that is consumed before fast should have a portion of food components which give rise to a immediate increase in blood glucose levels, and also should have a sufficient portion of complex carbs and high fiber which delay the absorption of glucose from stomach and give a prolonged glucose levels increase in blood, so that they don't have the tendency to go into very low sugar levels or develop hypoglycemia. Second thing, during this period they must keep watching their glucose levels, because the risk of hypoglycemia goes on increasing and they can suddenly have very low sugar levels. So generally we don't advise diabetes persons to go for fast, but if they still want to go for fast, certainly they need to consult their doctors or dietitians and make necessary changes in diet or medication before they go for fast.
Right, so it's essential to keep a watch on glucose levels as well. I just want to talk about exercising now. Dr. Sabu, maintaining a normal workout routine during fasting can be hard. Now, because of interrupted sleeping patterns and a lack of liquids and a variety of other reasons, can a person with diabetes go for exercise during fasting?
Very relevant question actually, because many of the patients ask this to us. If it is a religious fast and they are doing it for Ramadan fasting, it definitely impacts their the schedule of the sleep and all those things, which again contributes to the diabetes fluctuation. So they are actually instructed to avoid the strenuous exercises, especially in the ending hours of fasting. They can do it in the morning, but at the evening time they should restrict doing any strenuous exercise. Again, as Dr. Makkar has told, keep your sugar in check, keep monitoring, and once you keep monitoring, actually it helps you to know whether you are going into a hypoglycemia or not, because some patients maybe are at risk of hypoglycemia which they are not aware of. Secondly, those people who are doing fasting for weight loss and other things, they are again advised to check their blood glucose values before exercising and after exercising. Again, the regime remains the same. They should do exercise after consulting their doctors. They should not go with consultation of anyone, but they should consult their diabetes care team, because their health profile may differ for certain set of exercises and it may impact them badly if they go wrong.
Right, many Muslim type 2 diabetes mellitus patients choose to fast the month of Ramadan despite the possible adverse health effects brought about by this change in dietary habits, among other things. Now, Dr. Agarwal, what about alterations in anti-diabetic medications?
I think that's very important, and now actually Ramadan is approaching, so this is something that we have to always advise in our practice. A lot of patients come to us and they ask us that how should they manage diabetes during the period of Ramadan. Remember, in Ramadan, patients tend to have a very small snack very early in the morning before sunrise. They don't eat or drink anything during the entire day. And then at sunset, they tend to break the fast, have prayers, and then tend to eat their meals, which often are very rich meals. So it is important that all patients who have diabetes should be pre-assessed for their fitness to undertake such a rigorous fast. So we look at, of course, what kind of medication somebody is taking, how good the control of blood sugars are, have they been experiencing any low sugars, do they have other sort of medical problems like heart problem, kidney problem, and we risk stratify them. So people who have a very low risk for any problem, they are the people whom we do advise to continue fasting. Whereas the other end of the spectrum, people who have very uncontrolled blood sugars, people who have multiple comorbidities like heart disease and kidney disease, people who experience repeated low blood sugars, they are a very high risk population. And these are the set of people whom we perhaps will not advise them to undertake the fast. Now, if you see the patterns of eating, what we generally eat in the day, they tend to eat in the night, and what we sort of have very sparse meals during the night time, that is the daytime for them. So we have to invert our medication regimes. We have to sort of, give the morning doses in the evening and the evening doses in the morning. So suppose somebody is on only a once-a-day treatment, then we just tell them to shift the timing of the medications from morning to evening. Now, suppose somebody is on a twice a day, then the evening dose becomes the morning dose, and the morning dose becomes the evening dose. In short, what we need to sort of keep in mind is people tend to eat more in the evening and nighttime. They tend to have a lot of fats, carbohydrates, sweet foods, and we need to see that these are adequately covered by adequate amount of medications. We try to use medicines which are going to be safe, neutral, and it does not cause any low sugars. So people are on insulin or oral medications which will cause low sugars, we should try and either cut back on the doses or change them to more safer medications. And pay attention to the hydration, because they don't drink anything in the day, and particularly in summer months where we expect that there will be a lot of fluid requirement, we need to see that they are adequately hydrated in the evening. And most important is test the sugars frequently, as often as possible, so that you can ask them to break the fast in case they're heading for any problem.
Right, Dr. Agarwal, thank you for breaking that down for us. Again, hydration is key and also essential that pre-assessment of fitness is recommended before undertaking any rigorous fast. Dr. Makkar, I have 3 correlated queries for you, please. Can a patient monitor blood sugar while fasting? Can a person do finger-pricked sugar test during fasting? And how does continuous glucose monitoring systems help these people?
I think, again, very important queries, and I will take them one by one. So, first thing is, can they test their blood sugar during fasting? The answer is not can they must check their blood sugars during fasting, because that is the time when they are going to have very wide fluctuations in blood glucose levels because of the changes in diet and the longer gaps between eating. So if they are not monitoring their blood glucose levels, it will be something like, driving blindfold on a highway, and you are very likely to hit an accident. So it is very important to know whether the sugar levels are going high, because usually, especially the fasting during Ramadan or even the fasting like Navratris, people tend to eat 1 or 2 meals, and those 2 meals are very large meals with very high calories. So they are likely to have very high glucose levels post meals, and during the gap between the meals, they are very likely to dip very low. So it is recommended to increase the frequency of testing during that period of fasting. Now, second question is, can they do testing with finger prick? Yes, I think there is no reason why they cannot test with a finger prick device, and it is one of the simplest way of knowing your glucose levels, because it gives you glucose values instantly. You can understand how your fasting or your meal size or your medication is getting affected during the fasting period, whether you need to consult the treating physician right now or no. so many things you can make, and it is actually, it gives you an informed decision making to allow to do better during the fasting period. Third question is, can we use something like continuous glucose monitoring? So continuous glucose monitoring is a very novel device that is available now in India. It is available globally maybe more than a decade now, and it can help in knowing the blood glucose level any number of times by simply flashing the controller over the sensor that is applied. So just for everyone's knowledge, I'll try to explain very simply.
Yes, please.
There is a sensor which is applied on the back of arm usually, and there is a controller or there is an app in the phone which communicates with this sensor, and through this sensor you can actually see the blood glucose value anytime between 5 to 15 minutes. You can keep seeing the values, so you can see your blood glucose values maybe 100 times a day also, and you don't need to prick again and again.
Right.
And the life of this sensor is about 7 to 15 days depending on what sensor you are using. So it gives you very good ease of monitoring the glucose levels and deciding when you need to intervene. If your glucose levels are going very low, you may need to break fast, you may need to stop medication, you may need to change medication depending on the glucose values, and you may need to consult your treating physician. The only drawback of using sensors is they are quite expensive in Indian setting, and unfortunately our healthcare system does not provide for sensors or CGM, and even insurance doesn't cover for that.
Right. Gentlemen, stay with us. We're slipping into a very short break, but we have a few more unanswered queries on the other side that our experts will help us decipher. Do stay tuned to NDTV 24/7. Welcome back. To discuss issues regarding diabetes, we have with us today an esteemed panel of experts. Dr. Sabu, I'd like to take this one to you. Diabetes is associated with many other comorbidities and other complications too. Now, with home glucose monitoring, what things do people with diabetes keep a check on?
Oh, wonderful question. Actually, the home glucose monitoring is a thing which, if done properly, can solve all the queries and the problems related to diabetes, because a lot of times we as a doctor even are confused that what is the blood sugar fluctuations with the patient. If the home blood glucose monitoring is there, it gives us a chance, as Dr. Makkar has told, to make us an informed decision making, because that is very important in diabetes, to know the timely graph, how the blood sugar is behaving. Apart from checking on the immediate complications of diabetes like hypoglycemia and hyperglycemia, the long-term benefits are multifold and many. It can range from a reduction in cardiovascular disorders, stroke. It can reduce the peripheral neuropathy. Even it saves your eyes by preventing the retinopathy if you check your blood sugar values at home regularly and give the values to your caregiver or the diabetes care team to act upon it. Secondly, what it does tell the patient that what foodstuffs to avoid, what activities are to be done, and how his lifestyle is impacting his overall blood sugar milieu. So home blood glucose monitoring, if done correctly, can even prolong the life of the patient and make him disease-free for a longer period of time.
Right. Dr. Agarwal, it's been clear with the conversation we've been having that fasting could compromise one's health. Now, at what level of sugars would a person have to break their fast? What do you suggest?
I think let me just rephrase that question, because it's not just the blood sugars that would determine when should somebody break the fast. I think there's a whole lot of other things that would make us decide that can we allow the patient to continue fasting or not. So typically, if you just ask me about the blood sugars, that anybody who's getting wide fluctuations in the blood sugars, anything more than 300 milligram per deciliter or less than 80 milligram per deciliter, I would definitely recommend these patients to stop fasting. But important is that if there are signs of dehydration, or if their blood pressures are fluctuating and they tend to develop low blood pressures, or they're experiencing extreme tiredness, fatigue, drop in the urine output, or they're getting too much of ketones and acidosis in their blood, then these are patients who are really not suitable for continuing the fast. There are patients who need hospitalizations for various reasons, during this period. So, when they are hospitalized, we do have to tell them they have to stop fasting and follow the protocol of treatment as per the hospital schedules. We have to educate our patients not to be rigid, because often people, for religious reasons, tend to become extremely rigid to stop, not to take the advice and discontinue fasting. So these are the people who need to be counseled well why they should stop and what problems can occur if they don't stop fasting, particularly in type 1 patients, which can make them more prone for development of diabetic ketoacidosis. So, these are various reasons why I would probably recommend my patients that they should not continue fasting, and we should be vigilant to pick them up early and advise them in time to stop fasting.
Right. Dr. Brijmakar, does a person with diabetes need to go for a post-Ramadan follow-up?
Yeah, I think it is important. If during the Ramadan period, person has changed it, one's medication or the treatment regime, or the glucose levels have been fluctuating wide, they must consult the treating physician, because they may need to change the treatment strategy again. They may need to be advised the change in medications they are taking or the dietary regime they are following. And of course, most important thing is they have to keep monitoring their glucose to make sure they are in the control range, and the minute they feel they are going outside the control range, they must get back to their physician again.
Right. I'd like to take this next one to Dr. Sabu, please. Now, fruits are generally considered good. They're considered fiber, nutritious, etc. But do you suggest people with diabetes should consume fruits excessively? On what quantity?
Actually, it depends on the calorific value of the fruit. It should be made very clear that every fruit is not alike. There are some fruits which have a low glycemic index, which can be apple, guava, you can have kiwi in it, and some fruits which are having a medium glycemic index like watermelon and papaya. Some fruits have a large glycemic index. So it would be decided by the diabetes care team depending on the other comorbidities which you have. Suppose you have a renal disorder, so you should not take citrus fruits.
Right.
It is advised to avoid citrus fruits. So it is not a one point fits all sort of regime that if someone is taking, you can take it also.
Right.
So it should be decided by your diabetes care team which fruits you can take. But for all the diabetic patients, I would advise one thing: you should avoid fruit juices, because juice kills the fiber content of the fruit, which is very essential for the delayed sort of gastric emptying, and it gives a feeling of fullness also when you have a fiber in it.
Right.
So this sense of fullness gives you that satiety which impairs the extra calories which you take, and above all, it also reduces the constipation which you have. So
Right.
this is my take on it. Thank you.
Thank you so much for joining us, doctors, with your suggestions and invaluable insight. Until next time, gentlemen, it's been a pleasure. Thank you for watching.